Happy Tuesday, guys. Hope you're doing great. I am going through more of the different variations of anxiety disorders in adolescents, and this one is OCD. Fairly uncommon for adolescents, but 2 to 3% of the adolescent population does suffer from OCD, which is intrusive thoughts, followed by compulsive behavior and rituals that they participate in. Unfortunately, this affects their daily functioning and their social interactions because they are so focused on these intrusive thoughts that will just not leave them alone. Next on my list is PTSD. I'm sure all of you guys have heard about PTSD. It's post-traumatic stress disorder, and it is when a adolescent has had some sort of a traumatic experience or traumatic event in their life, usually earlier in childhood, and it really stays with them throughout their adolescence. And if it's not treated, it will get worse with time, unfortunately. And usually someone who suffers from PTSD will have flashbacks, will have nightmares, terrors, and will really feel as though they are reliving this traumatic experience or event over and over again. Next on my list is panic disorders, and that is when the adolescent experiences, it's very similar to the way adults can experience panic attacks, but it comes with a group of symptoms or side effects of the panic disorder, and it is sweaty hands, heart palpitations, nausea, feeling as if they are having a heart attack is usually the way that most adolescents describe the feeling, almost like their heart is giving out on them, and just derealization and a feeling of they are not themselves and they are living in like an alternative reality for a few moments. Usually a panic attack peaks and ends within 10 minutes. A lot of teenagers or adults, in this case, very similar situations, will go to the emergency room and complain of having a heart attack, as I said. And often they realize that it is just a panic attack, and they are sent home with something as simple as a pamphlet that tells you what to do in a panic disorder. I will go through the treatment of all of these disorders in my next session because they're all kind of treated very similarly, of course with specifics, but these are the most common types of anxiety disorders living in adolescence. I hope this helps you guys, and I'll see you guys next Tuesday. Thank you.